So you've had your penile prosthesis surgery, and now it's time to talk about recovery. Think of this as your personal roadmap. We're going to walk through everything you need to know, step by step, so you can feel confident and really in control as you heal. Let's get right into it.
We've broken this down into 5 key parts to make it easy to follow. First, we'll cover what you can expect in the days and weeks right after your surgery. Then we'll get into a timeline for safely getting back to your normal activities. After that, we'll touch on daily care, medications, and, last but not least, the really important stuff, knowing exactly when to call your doctor. This is your guide to a smooth recovery.
All right, first things first. Let's talk about what's normal. The first couple of weeks after any surgery can be a little unnerving. Knowing what to expect ahead of time can make all the difference in feeling reassured that everything's on track.
Okay, so you might see some things that seem a bit alarming at first, but I want to assure you, this stuff is a totally normal part of healing. You should expect some bruising and swelling for the first 2 weeks or so, a little bit of bleeding from the incision, even some discomfort when you urinate. That's all pretty standard. You'll probably also feel some pain at the operation site, especially down the road when you start using the device. Seeing these things just means your body is doing what it's supposed to do.
Next up, let's talk about activity. I know you're probably eager to get back to your normal routine, but listen, your body really needs time to heal up right. Sticking to a clear timeline is the absolute best way to make sure that happens without any bumps in the road.
So here's the timeline you'll want to keep in mind. For the first 3 weeks, try to avoid any long trips. Until you hit week 4, no heavy lifting. We're talking nothing over 10 pounds. And, of course, no sexual activity. And then for a full 6 weeks, you've got to hold off on really vigorous stuff like mowing the lawn or shoveling, and also any straddling activities. So, no bikes or motorcycles. The bottom line is, just listen to your body and stick to these guidelines.
Now, even with all those restrictions, we absolutely do not want you to become a couch potato. In fact, it's just the opposite. Light, regular activity is actually a great thing. A few short walks every day can make a huge difference in how well you recover.
Okay, listen up, because this next part is maybe the most important rule of all for the first month. For 4 solid weeks, you have to keep your penis positioned upwards, pointing toward your belly, inside your underwear. This is absolutely critical. It ensures that everything heals in exactly the right position.
All right, let's shift gears and talk about your day-to-day care. The little things you do every day, like hygiene and what you eat, they make a huge difference in your recovery. These are the foundations of healthy healing.
Good news, you can start showering just 48 hours after your procedure, and it's really straightforward. Just use your regular soap and water to gently wash the incision area, rinse it off really well, and then carefully pat it dry. There's no need to scrub or anything like that. Just a nice, gentle daily cleaning is perfect.
So, to make it super simple, think of it like this. Do shower every day, but definitely don't get in a bath or a hot tub for 4 weeks. Do get back to your regular diet as soon as you feel up to it, and whatever you do, don't forget to drink plenty of fluids. These simple do's and don'ts are key.
And while we're on the topic of drinking fluids, here's your magic number. You want to aim for about 6 to 8 glasses of water every single day. Staying hydrated is one of the simplest and, honestly, one of the most effective things you can do to help your body heal.
Next up, let's talk about medications and bowel habits. Now, I know those two things might not seem connected, but trust me, they're both super important for preventing any extra strain or complications right where you had surgery.
When it comes to your meds, the rules are pretty straightforward. First and foremost, take everything exactly the way your doctor prescribed it. You can go back to your normal pre-surgery meds unless you were specifically told not to. And make sure you get crystal clear instructions from your doctor about when to restart things like aspirin or other blood thinners. And here's a huge safety tip. If you are taking any narcotic pain medication, you should not be driving, period.
So, why are we spending time talking about bowel habits? It all comes down to one word: constipation. And for our purposes today, what we really mean by that is just the act of straining. You have to avoid straining at all costs because it puts a ton of pressure right on the surgical area, and that's the last thing you want while you're healing. So how do you avoid that? Well, we've got a simple 4-step game plan for you. 1. Get more fiber in your diet. Eat plenty of fruits, veggies, and salads. 2. Drink lots of fluids, like water or even prune or apple juice. 3. You can use an over-the-counter stool softener like Colace. And 4. If you still need a little help, a mild laxative like Miralax is a good option. Being proactive here is your best bet.
All right, we're at our last section, and honestly, this might be the most important one of all. We want to empower you to make sure you know exactly when something isn't right, and it's time to pick up the phone and call your doctor.
So, let's say you're at home.
You're recovering and something just doesn't feel quite right. How do you know if it's just a normal part of healing or if it's a real warning sign? Let's answer that question right now.
If you experience any of the following, I want you to call your doctor's office right away. Don't wait. A fever over 101 degrees Fahrenheit, or you're getting chills. If the incision starts looking red, more swollen, if it opens up, or if there's any pus-like drainage. If you find you can't urinate for 8 hours straight. If you're in severe pain that your medication just isn't touching. If you're feeling nauseous, vomiting, or you just can't keep any fluids down. And finally, if you can see any part of the device starting to come through the skin. These are your signals to act immediately.
Okay, before we finish up, I have one more really critical reminder for you. I know it might be tempting, but it is absolutely essential that you do not try to inflate the device before your surgeon tells you to. You'll have a follow-up appointment in about 2 to 4 weeks, and that's when they'll teach you exactly how to use it safely. A little patience right now goes a long way.
And that brings us to the most important takeaway of all. You are not in this alone. Your recovery is a team effort. You've got this guide, you know the warning signs to look out for, and you should always feel comfortable reaching out. Never hesitate to call with a question or a concern. There are no silly questions when it comes to your health. Your team is there to help you get the best possible outcome. Following these steps is your path to a great recovery.